Every year in Pakistan, we lose somewhere between 400,000 to 450,000 children under the age of 5. Now that's a large number, close to 500,000 deaths every year. Now once you go beyond the newborn period, the first 4 weeks of life, the two major killers of children in Pakistan, roughly accounting for about 25% of deaths each, are diarrheal diseases and pneumonia. But diarrheal diseases are things that we absolutely should not have killing children in this day and age, because the solutions and the interventions to prevent and manage diarrhea have been well known for decades.
This is the child. His name is Saira Akhtar. He's 3 years old and he's a resident of Bilal colony. He came to us with the complaints of diarrhea and pneumonia. When we examined the child, apparently he is of 3 years old, but he is severely underweight and undernourished. So we will go through it and we will ask that what are the risk factors and what has made the child like this. So, बीवी ये कब से बीमार है?
ये जो क्या ऐसा था?
जब से पैदा हुआ ऐसा हुआ? अच्छा ये बताइए कि इसको दस्त रहते हैं बार-बार?
रोजाना दस्त, एक दिन के बाद इसको दस्त।
हर दिन के बाद इसको?
जुकाम, सीना खराब होता है इसको।
ठीक है। तो दस्तों के लिए इसको आप क्या दवा इस्तेमाल करती हैं या क्या करती हैं?
परवेश में लेके जाता है, कभी ड्रिप लगाता है।
ठीक है, ड्रिप वगैरह लगाइए इसको। ये बताएं कि आपके घर में जो आप पानी इस्तेमाल करती हैं, वो पानी कौन सा इस्तेमाल करती हैं? कहाँ से आता है?
बाजार से।
बाजार से लेती हैं। वो साफ पानी होता है या गंदा पानी होता है?
साफ होता है, क्यों गंदा क्यों?
I think there is a lot of need for education of communities in terms of the safety standards for foods that are available in the market, and all of these add to the increased risk of developing diarrheal disease.
It has been shown that at least 50% of the mineral water that is available in our markets are heavily contaminated.
Every day, children continue to die due to diarrhea and other diseases related to unsafe water and sanitation. But simple, effective and affordable interventions like hand washing with soap and water can help to reduce diarrheal morbidity by up to 47%. 3-year-old Sobia suffers from chronic diarrhea, but her mother is still confused about what seems to be causing it.
ये हमें क्या पता है क्या होता है? जब पैदा हुई थी ना इससे झटके लगे थे, उसी वक्त से इसी पेचस लगा है बस। इसको हमने बहुत खर्चा किया, वो इसको पाँव भी नहीं चल सकता।
As weak as Liaquat might be, he's one of the lucky ones to have made it to the hospital in time. But many children who suffer from diarrhea perish at home.
They come in so late that providing such treatment might not be enough, and they end up not being able to revive them.
Efforts have been made in this country for about 2 decades now to try to control diarrhea. Can you tell me a little bit about sort of the limitations of the existing programs, why they haven't worked?
Well, to begin with, I would dispute if real efforts have been made to reduce the burden of diarrhea. The reality is that roughly only about 60–65% of our population has access to safe water.
In a bid to tackle the huge burden of diarrhea in this country, the Al Khan University Hospital is running a project in Khairpur and Pindadan Khan where they're introducing a diarrhea pack to patients.
You can see this water purification thing can be used for 5 liters of water.
Some 5 years ago, it became clear to the World Health Organization that the use of zinc for the management of diarrhea, the zinc supplements, improved diarrhea survival significantly. And it was recommended for implementation worldwide. Yet, 5 years on, very few countries in the world had even included it into their national strategies.
Not only community, even most of the doctors does not know about the zinc. Zinc actually improves the intestinal flora and it improves the health of the intestine. In this diarrhea pack, we have incorporated the low osmolality ORS plus zinc. And in addition, we have put in a water purification sachet as well.
One of the biggest problems is that in many pharmacies in Pakistan, patients coming in with diarrhea are often automatically dispensed antibiotics.
A great problem in our part of the world has been the abuse of antibiotics.
Every child does not need antibiotic for the treatment of diarrhea. It is the malpractice of the some GPs and pharmacies. Unnecessary use of antibiotics is obviously making the child resistant to that antibiotic.
The AKU is hopeful that the government will decide to scale up this intervention and implement it nationally at pharmacies and hospitals in order to reduce the abuse of antibiotics.
With all the components thrown in, the package should cost no more than 40 rupees, which is less than $1.
And you're confident that people will take to it and that they will buy it?
That's the hypothesis. And since in this country people are able to buy Coke as the treatment of diarrhea, so I'm pretty confident that if you're able to give them something which works as opposed to something that does not work, they will improve diarrhea management. Actually, the more common notion is that 7-Up is the best rehydrating fluid, and it's complete nonsense.
Really?
Absolutely. It's a hyperosmolar fluid. It will actually worsen diarrhea.
After the break, we look at some more attitudes and misperceptions that wreak havoc on the health of Pakistan's children.